and then to a computer or a workstation. What are we going to get exactly? So if you observe the concept of brain-computer interface, just quickly give me a glimpse of that. When we have an interface or a communication possible between two nodes, something like this, a computer and human brain, or any other similar component from the human body, under this human computer interaction, we are going to have first we can have some data to be stored, like either first we'll talk about only from like brain or any other component of the human body to computer or a workstation. When you record such a signals or such a data and represent in a computer or a server, what type of specific application we can address. Now if you just broadly look into the challenges we have in other domains, like now see many of you are working in different domains. Somebody is cloud computing, somebody is in sensor network, somebody is in security. Can you just tell me what is the first problem you have faced in your field of research?
Sir, we are seated far away, so we cannot, we are not audible by each student.
uh, that's fine. So when I say, see, like somebody is working in different domain, if I exactly look into my first problem that I face is availability of the data. If I come to know, uh, in this domain, if I make an interface between two objects, something like a brain and a computer, or maybe a heart and a computer, then I would be able to make a lot of data recording, where I can use such a complex patterns to analyze and then to achieve a lot of real-time applications to be addressed. Now, the problem we have in other domains, like availability of the data, is one of the challenge. Here, this domain, we begin with data acquisition when we refer, whether it's a brain-computer interface or any other sort of interaction we are trying to establish between a computer and some part of the human body. Now, if I broadly look into somebody's brain signals, I'm going to capture by using such an interface, and then I would like to make some application. What type of application we can refer in this? If you observe, this is very interdisciplinary nature. Like this, if I simply talk about a brain signals to be captured and used for some real-time analysis, we can have hundreds of applications. Now, one such well-known application could be like lie detection, human contemplation, IQ analysis, and then neural prosthetic devices, and then healthcare like even retinal implants and many other complex applications we can address. Deep brain stimulation, transcranial magnetic stimulation, and lot of other neuroprosthetic related devices. Lot of applications we can attend. That's why such a domain is called as very interdisciplinary in nature. We can have applications in defense, we can have applications in like cybersecurity side, we can have applications for healthcare, many other. Today we just broadly see most of the applications toward healthcare because the thing of this. Now when I look into the dream of the researchers with the evolvement of such a domain, it has become now a target for the researchers when they have understood the concept of artificial neural networks which are evolved from the biological neuron model. They are ruling the computing world now. If you observe the concept of artificial neural networks, how a cell body functions, how a neuron to neuron communication takes place, how an action potential is generated, we just look into that, how exactly such a communication is used to develop the artificial neural networks from the biological neuron model. Now they are simply ruling the computing world now. ANN, conventional artificial neural networks, deep neural networks, and how about learning beyond that? If you observe, brain is a factory of neurons, right? When a neuron communication to communication, like neuron to neuron, how it develops such a complex architectures, and we use them for all these real-time applications. If you biomimic the entire computing nature of the human brain as a whole, you can have even higher sophisticated applications, and then complex hardware architecture that can be a blueprint for a lot of complex architecture, because so far what we have understood is less than 1% of the human brain, right? Therefore, it has become an attractive part of the researchers. How do they address these challenges, and then use for various real-time application under this umbrella? As I mentioned, the type of applications that we extract from this domain is completely different from other domains. in terms of motivation. If I talk about a simple lie detection application, if you can develop a universal model that accurately classify, maybe with 100% accuracy, that a person is lying or not, eventually what happens, that its impact is very very broad and wider in the nature, where we can address a lot of high end problems if we can come up with a universal lie detection model, right? See, similarly, prosthetic devices who lost their limbs in accidents or somewhere, we can develop a robotic arm type device, a prosthetic device which is controlled and automated by real-time brain signals. So, a lot of challenges are there. Now, if I ask you a simple question, what about the privacy and ethical issues in this domain? When I refer the, because when researchers dream of the future innovations in this domain, I would also like to talk a few lines about the consequences or the ethical and privacy issues. What happens if one can record the brain signals from someone? What could be the possible consequences? Now, if I just want to talk about to convert this problem with a simple machine learning or data mining problem, if I ask you what is the first, can I read your ATM pin number from your brain? The answer is yes or no. As of now, we can say may not be precisely. I can read your ATM pin number from your human brain. Whether or not it is correct, that I will see the dimension later. But when it comes understanding brain signals, analyze them, and extract sensitive data such as your ATM PIN number or any other confidential information. How about how it is possible? You can say. First of all, is it possible in your opinion? Can I read your ATM PIN number? Okay. Let's see exactly if you can do this, or at least we can see whether it can be possible. As of now, it not so accurately or precisely we can do that. If I look into, or if I ask you a question, what is the first digit of your ATM PIN number? How many options we have? Can somebody guess? Anyone? It should be 10, right? Maybe
10.
0, 0, 1, 2, and so up to 9, right? Total 10. Now, just let me convert this complex problem, an ethical or privacy problem, as a simple data mining problem. Now, if I ask you, now I have 10 signals. If I'll just show you on the on a screen to one subject asking to I mean a specific question like is this is the first digit of your ATM PIN number, either 0 or 1 or 2 and so on up to 9. So when I extract 10 brain signal, just in general, not precisely, if I extract 10 brain signals, out of them are how many are positive, how many are negative? Can anybody guess?
Hello, sir, audible?
Repeat.
Hello, sir. Am I audible?
Yes, yes.
Since you asked me how many positives it could be, sir, it could be any number, right? As you said, total 10.
Yeah.
It could be 73 or
See, there is a
4 point.
see first digit of your ATM PIN number. If I refer one any one either 0 or 1 up to 9. If I record 10 brain signals asking 10 questions like whether 0 or 1 are showing that particular digit on the screen, when your eyes just note that particular number, and when your associated brain signal is generated, out of 10 signals, obviously one is the positive, other 9 are negative, right? One positive match when you are exactly see your number, and when your optic nerve communicates to the human brain that this is the okay, this is my number. You may not reveal that, but your brain knows what is the correct number. So eventually it's a classification problem. Is it not a binary classification problem? Now we have a 10 brain signals where I classify into two groups, 9 into one group, the negative group, one in the positive group. Do you agree?
Yes, sir, definitely.
Now if I ask the same question for every digit, like 10 questions for one digit, then 40 questions if I ask, I'll be able to, like we have four classification problem, binary classification problem. I may be able to predict what could be the ATM PIN number of a specific person from whom the brain signals are being extracted. I'm not talking about the ethical privacy sides of this question or this research. I'm just trying to give you a motivation. What is the significance or importance of this domain? Try to understand. And so far is a long way to go to have such a precise extraction of brain signals from the human brain. As I've already referred, we have understood what we have understood is less than 1% of the human brain. Therefore, there's a long way to go. And on the other side, when I refer, If I talk about the brain signals and all, I'm just sharing now. The complex brain signals and all. I'll just like to show some small video for about just 1 minute. A small video where you can just understand the complex structures of the human brain.
Nervous tissue. Objective: to learn about the nervous tissue and its functions. If a person unknowingly touches a hot object like a kettle, she immediately pulls back her hand. Why does she do this? This happens as the receptors present in the fingers sense the heat from the kettle. The sensory nerves in the fingers absorb this impulse and transmit it to the spinal cord. From the spinal cord, this impulse passes to the motor neuron, which in turn passes this impulse to the affected muscle in the finger, and the person immediately removes her hand from the kettle. This whole process involves coordination among the nerve cells called neurons. These neurons are found inside the spinal cord and the brain. Now let's learn about neurons. A neuron consists of a cell body called soma. The soma is enclosed by the cell membrane and has a nucleus. There are several thin, thread-like extensions from the cell body called dendrites. The dendrites receive impulses from the adjoining neurons. The other extension from the cell body or soma is a single-branched extension called an axon. Each axon is comprised of a cone-shaped base called an axon hillock that arises from the soma. At the other end, the axon is divided into many branches, from where the signal passing through the axon is transmitted to the other cell via a junction called a synapse. Thus, the information is received by the dendrites and is then sent out through the axon to the neighboring cell. This is how information is transmitted from one cell to another. To summarize,
See, in the short video, what we have just seen, we have seen how the neuron to neuron communication takes place and how the muscle receptors and the action potential is generated through them. How a signal is analyzed with the help of central nervous system and spinal cord, and which averages the communication all over the body. If I just look into the complexity, the major complexity involved in this research is, if I just ask you a question, how many thoughts normally a common man brain has per day? Any guess? It's about 70 to 80,000 thoughts per day. 70 to 80,000 thoughts, or maybe more than that, on an average, a common man's brain. Now, our challenge here is in that ATM example, also what I have just now referred. It appears to be very simple, like make a binary classification problem, but it's not so easy. Extracting such a complex brain signals from about that 80,000 or maybe more than brain signals. How do we extract such a specific signal corresponds to your application, whether it's lie detection or human contemplation or mental state analysis or anything? That is a major challenge here. So how do we precisely understand? Now whatever the reaction happens in the human brain is a chemical reaction that produces an electrical discharge signal that we call as an action potential. And if you observe that jumps from like one neuron to other, it's about 250 miles per hour speed. then how such a complex signals, which are very huge in number and complex patterns, to be identified, captured, analyzed, and then we need to make all these applications. That is a major challenge in this domain in terms of data acquisition and processing. And eventually, at the end, we require some deep learning or other machine learning models to deal with them. Now, though it's not a biology session, just I'm not going to talk too much about the human brain, but you need to understand the basics of human brain when we refer the interface to a human brain by a computer, and then use such a complex data to understand these various applications, 4 or 5 what I've highlighted so far. Now, brain has two hemispheres, left and right. Both have like this frontal, parietal, occipital, and four lobes. And you, if you are interested in this domain, please go through all these various cognitive functions of the human brain, particularly each lobe. What is the various roles and responsibilities of the various lobes, and which particular lobe is performing or active in motor imagery or motor movements, and which is for other type of activities that you need to go through, because it's very very important. Where do you take the brain signals from? Unless you understand the inherent structure of the human brain, cerebral and subcortical region and all these complex structures, you may not be able to take the data, though you are very good at machine learning or other deep learning models. Unless you have a good signals, you may not be able to process them in a better way. So I'm not going deep into the subcortical structures and other part of the human brain, where you can refer in case you are interested further in this domain. Now, when it comes to the type of data, whether I'm using for some healthcare application or any other application, so we have to understand what the various type of data. Now, if I talk about even MRI machine also, MRI machine, that's also a kind of human computer interactive system or a brain computer interface model, because I just record some brain images, and then when these magnetic resonance images are captured, of course there are a lot of noises involved there, and subject to type of interaction, the type of data, output data, what you're going to record, and the challenges in the data can be different. So similarly, we have fMRI, functional magnetic resonance images, NIRS, CAT scan, PET, PHFMRI, MRI, TMS, transcranial magnetic stimulation. A lot of other data sets are available here in connection with the human brain related activity. Now, you may ask when choose, if I'm very interested for like some computer vision application for brain tumor detections and all, you may not be very convenient to deal with EEG image, EEG, EOG, MG, or other type of signals. Maybe you can focus on like MRI or fMRI, PHMRI, etc. And the mental state analysis type of data, maybe EEG or TMS data, something like that you can use. Selection of proper data sets for the same application. You have multiple data sets. Sometimes somebody uses MRI, somebody uses CT scan, then you need to identify which specific application you are taking. That's very important. And just to have quickly to add, it's very important to understand how about a non-invasive mode of data acquisition to be performed here, because most of the time we are working only experts when we talk about they refer this invasive mode of data acquisition, because the data acquisition in BCI type systems, when this complex brain is safely located under multiple layers of coverage, like we have initially scalp, then skull bone, dura mater, periosteum, subdural space, supranuclear space, and finally the brain is safely located. So here we connect the electrode wire on the scalp, and then record the brain signals from there. And obviously, because we are recording from all those complex layers of protection, there will be a lot of noise and artifacts may be involved. Even noise can be due to some external factors, even similar artifacts as well. Therefore, you need to maybe required to amplify about sometimes maybe about 10,000 times, and then filtering the signal in pre-process. That is the preamble. Now, this is my overall like the experimental setup. I have a subject and a patient. The patient can be precise, but where some healthcare related application I'm taking the data collection for, and then subject can be a generic word where I have my BCI system. In the front end, we have a device. It could be a smart wheelchair, an IoT, an integrated smart healthcare IoT system that is BCI controlled using some deep learning or any other machine learning model. So a BCI enabled smart wheelchair system for paralyzed, immobile, or locked in persons for the just assistive mechanism. That's one such healthcare application using brain computer interface. Are you following? We have a subject
Yes.
from where we take the data. We have my BCI system. Then we have a front end device, could be a healthcare device, maybe a smart IoT system, a smart wheelchair, which is for paralyzed or locked in or immobile person who cannot move or walk. And we have a BCI assisted system, an integrated system that is controlled by real time brain thoughts. something like that. So the front end controlling device is from the real-time brain signals of the human brain, right? And so this is just a, basic operating environment. Simply written, we have a subject and we take the data from subject in a non-invasive mode of data acquisition. Invasive we don't refer because that is to be done by the experts. And then we have a EG amplifier that amplify the signals, and then we have a workstation where we store the signal. Then we have a feedback screen in the front end. And what you require a feedback screen is, as I mentioned, it's difficult to identify the cognitive levels of the human brain to be stabilized when the data is recorded in a conventional mode. So we need to have a lot of training to the subject. So we need to look into the quality of the signal they are being captured in real time. Therefore, we take subject 1 data, trial 1, trial 2, trial 3. Subject 1, different trials, about 15-20 trials maybe you can take. Then subject 2, 15-20 trials you can take. So multiple subjects and multiple trials. So you can have horizontal or vertical validation of your model, and different subjects of different age groups or gender, etc. And then you can have different trials for each subject. See, data acquisition itself a contribution when it comes, or you write a thesis for your PhD thesis if this is your topic of interest. Data acquisition itself a contribution. That is, I'm talking about data acquisition on a predefined or some experimental methodology in the pre-art. If you can propose a new type of data acquisition mechanism, then that itself another contribution. If you can refer, try to understand what I'm saying now. So about 6 months I spent on recording my signal, that itself a contribution to me, because these type of domains require a lot of patience, and we have to make recordings for about 6 months or sometimes maybe 1 year when we are involving different type of complex particularly people who take up some research problems in the domains like neural processor devices or other complex hardware interface applications. You need to have a lot of patience to record the brain signals. And similarly, other type of application when we refer in terms of these neuromodulation type technique, where we try to have I mean, like how do you have a stimulation system where we try to, deal with problems like blocking the pain signals and blocking the hunger signals, particularly for these surgery times and even other type of applications when we refer. There are three types of neuromodulation. We have deep brain stimulation, transcranial magnetic stimulation, and vagal nerve stimulation. So in DBS, normally we try to place an electrode inside the human brain. Inside the human body, attached directly to the human brain. This is an invasive mode of data acquisition. This is not non-invasive mode of data acquisition. Where of course the electrode wire the other side has a battery pack, and that is implanted inside the body, and we try to record the real-time brain signals over a specific period of time. It's not something like a toddler or something that is attached to the human body for some recording of so and so signals, maybe ECG type data for 24 hours. This is implanted inside the human body. It's slightly different than that. Now, these type of data we use to deal with disease like Parkinson's, epilepsy, brain stroke, and even in the Torrance syndrome and other type of complications. See, in machine learning, first of all, getting a proper data or pattern, that is the challenge. Then next level, you have a lot of supporting models are already there in the pre-art. So there are some challenges with the deep brain stimulation as well, size of implant and all. But anyhow, that we talk about the invasive mode of data acquisition, those who are doing research with the help of some experts or some doctors. Now in TMS type device, I think we are getting time. We have TMS treatment device where this transcranial magnetic stimulation type applications, where we try to see how a person with a depression is undergoing for this treatment, and then how effectively they are going to record the brain signals for a specific time duration. Normally, these type of treatment devices are used for about so and so time, maybe every week, 3-4 times, something like that. Then they're going to take the signals like before and after the treatment, and you can see over the time interval of maybe 3 to 4 months, you can have a clear picture how it increases or improves the limbic system structures, and how the performance or cognitive functions of the human brain are improved, or how the person has used this TMS device to ease his depression. So in this normally what happens when a group of electrical charges are created or triggered by some pulses caused by this TMS treatment device, and then those electrical charges, they try to cause the neurons in that region where it is actually used they become active all the time. And you may ask, there are some challenges with this type of TMS. There are some side effects also, but when it comes, they are focusing only on the, top limbic structure of the human brain. Even eventually, they may not go interior part of the human brain sometimes, and the effect or influence may not be permanent for that reason. So this is one such treatment where you can, but is it invasive or non-invasive? And this is a non-invasive mode of, treatment, where you can also take the data recording when the treatment is like before the treatment or after the treatment, if you want, maybe during the treatment also. Problem is these type of applications, if you take data, that is like one of the, very important activity where we can, but getting such a treatment data would be very, very challenging. Now, similarly, we have other neural processing devices, something like this, where I try to make an integrated system, something like that, kind of smart IoT system, where I try to take real-time brain signals, EG or EMG or EOG type signal, and then try to integrate with a human. Integrate with a small Arduino or Raspberry Pi, and then try to have development of such a mechanical invention to have an effective control over the real time. So you see, this is one of the wonderful applications that can be used, and it has a lot of other functions which cannot be done by the conventional functions of the similar nature. Conventional, processor devices, which we have seen like a decade before or multiple decades before. And this is very, very, hot topic nowadays. A lot of research is going on. Similarly, we have retinal implants, but there's long way to go because fixation of such a lens and then connecting to the optic. Now, the major challenge in the retinal implants is how we can communicate to an optic nerve that directly connects to the human brain, because of the very nano connections in the human brain, or sorry, the optic nerve. It has become very challenging to make such an establishment of communication to the human brain via optic nerve. So, optic nerve is a very challenging part here. So there are some challenges with the processor devices in healthcare applications using brain-computer interface, such as speed of information transfer and position of the electrode wire, and feedback delay, signal quality issues, and all those things. And a lot of feature extraction model, classification models, they play a very crucial role in integrating with them and use for all those real-time applications to understand. When it comes dealing with EG, EG is not something a very new concept that was observed like almost a century before, and why people are having a lot of focus on now. When it was identified, an electrical field that was raised due to these large amount of neurons and their communication and the synaptic connections and structures. Unfortunately, there could not be much growth or evolvement in that domain because of the insufficient computing power and storage requirements. With the evolvement of big data analytics and cloud computing paradigms, it has become now possible to easily handle petabytes and exabytes of data. Now people started focusing over the last couple of decades in all these domains. Like this is like a old wine in a new bottle. Now, when it comes to EEG, we have different standard states of vigilance. When a person is alert, we normally experience beta waves. When somebody is relaxing, we see alpha. When somebody is sleeping, we see theta waves. When somebody is deep sleep, we see delta waves. And when it's paradoxical sleep, that is dreaming, we have different types. So we have to understand all such a complex benchmark states of vigilance of EEG and then use these signals. Like one such, we can develop a BCI enabled safe driving management system using IoT. So BCI enabled IoT system for safe driving management system. Of course, they will require some deep learning and machine learning eventually, where we can have a wearable EEG device attached to the driver, the vehicle driver, and whenever he is driving, we can have his real-time brain signal. And if at all I record some theta waves, then maybe I just need to alert by a voice alert mechanism, because now we are talking about autonomous system. So that's not a very difficult thing to have a voice alerted system or an alert mechanism that alerts the driver and also sends a message to the concerned person, and the vehicle can be automatically controlled in the event of such a states of vigilance are observed. So like as I mentioned, all these things have different, each has a different like we beta 13 to 30, alpha 8 to 13, and theta delta, everything has different. So this overall operating environment, as we can see for any such BCS system, we have a subject and we have a control interface, we have a user, and there is an amplifier, BCA control unit, and the front end the device is controlled by device controller, which takes input from a control interface that is connected to the BCA control unit based on the features and the classes, the classification that happens over the real time. This is a complete environment. Typical skeleton would be same for any such research that takes place in brain computer interface. I think I'm done with the time. I would like to stop here. If you have any doubts, please let me know.
Sure, sir. We can start with the Q&A session.
Yes.
Hello, sir.
Yes.
Really interesting.
Madam, you're not audible. Any doubts, sir? Please.
Hello.
Yes, I can hear you.
Great signals, right?
Madam, you're not audible. Your voice is not.
No. Hello.
Otherwise, you can post in the chat box. If there is any issue, you can post in the chat box as well.
Okay. Okay, fine. Can I just repeat? Can you hear me?
Yes.
Okay. So my questions are like your data is brain signals, right?
Hmm.
So now when you're taking brain signals, like how many brain signals you have to take to teach the machine? I mean, for the training purpose. Usually, what is that amount of data which you give?
The size, data set size you are asking.
Yes.
See, madam, now first of all, you need to understand when we talk about data, you talk about number of channels. It's not a one signal we are taking. There are some equipments like 8 channel, 30, 16, 32 channel, 64, and so on. Subject to your application, at a time I requires data from some number of channels. At a time, some 8, then 10, maybe 20. Then according from that many channels, typically normally we take from a subject for some these conventional application, like subject 1, we record those like selected channel, 8 channels. At a time, 8 different electrode wires we connect. Then we take about 5 to 10 minutes. Normally we take short trials. Subject 1 for about 5 to 10 minutes or 15 minutes. Then trial 2, trial 3, trial 4 for the same subject. Then next another subject. Like that, about normally 10 to 20 subjects minimum you have to take, madam.
Okay. Then
Because often when we send with 10 subjects, the reviewers used to ask, no, we require more subjects, like that they used to ask. At least 10 to 20 would be better, at least.
The feature extraction methods are using Weber transforms, which is a method for extraction.
Repeat.
The feature extraction methods. How do you take the features?
Teachers what?
So, after detecting the data, how do you take the features? The feature extraction methods.
See, once you record the data, now next you have first you go for like if required, lot of normally this type of data require a lot of noise, so some pre-processing is required, some filtering, noise removal technique. Then you go for feature extraction, classification, translation, all those things. So feature extraction you go for bad, binary, bad, and other, and then subject to your application you can use some deep learning or neural network or some neurofuzz inference system. But for feature extraction and all, you can use these bad, binary, bad type applications or any other feature extraction models.
Okay, sir. Yeah, thank you so much. Any more questions? That's all, sir.
So, madam, I'm sharing my email ID also because I think those who want to communicate, they can please feel free to contact me later. So, I posted my email ID and phone number as well. Those who are interested to ask any doubts, no, please they can contact me later also. Thank you very much. Hello. Sir, your audio, a lot of echo is coming. I think I'm unable to hear. Any doubts, please post in the chat box. If you are done, otherwise I can close.
Okay.
Any more queries, sir?
Yes, sir. One question.
Yes, sir, your voice is audible. Please, you speak from the same device.
Yes, sir. My doubt was now when you use prosthetic devices,
Yes,
so the as you said, you use the brain signals and then you pass it through Arduino and you pass it through Arduino and then you get the brain signals, right?
yes.
So how would you so you do you need an implant in the body to get
No,
those
no, no,
signals?
no. No, no, no. Normally, see, motor imagery. See, if motor signals, because normally when you talk about prosthetic device, we talk about motor signals, right? So when you talk about motor signals, normally what do we expect? We try to see which particular, there is something called motor cortex. Motor cortex is, I mean, mainly meant for this type of motor movements in the human body. So we perform motor imagery signals, then we try to record those signals, then we try to store it. Now question is, we don't require any implantation here. We take real-time brain signals which are of that motor imagery type, then we store them in this.
So it's a non-penetrative way, right?
Yes, it's a non-invasive mode.
Okay.
You don't require any implantation for prosthetic devices.
Yes, sir. Thank you.
So I can leave right now. Yes, are we done?
Yes, sir. Yes, sir. We are completing.
Okay, so may I leave the meeting room?